Hi, hello friends. So I hope everyone is doing good. So me, Dr. Sai Chandra. So in this video, I will talk about shoulder problems. So I'll talk about two things. One is rotator cuff tears. One is the frozen shoulder. Okay. Uh, Coming to the rotator cuff tears, ఈ rotator cuff tears అనేవి it can be. So whoever is joining the live, ప్లీజ్ కామెంట్ ఇన్ ద కామెంట్ సెక్షన్ బిలో యు ఆర్ ఫ్రమ్ విచ్ ప్లేస్, మీరు ఏ ప్లేస్ నుంచో కైండ్లీ కామెంట్ చేయండి. సో ఫస్ట్ రొటేటర్ కఫ్ టేర్స్. సో బేసికలీ ఇట్ కెన్ బి either degeneration, it can be because of degeneration or it can be because of the trauma. Hi all, whoever is joining the live, kindly comment in the comment section you are from which place or which country, which state. So many of the times patient will have some history of a fall from bike or slip and fall. Go to the nearby diagnostic center, they will get the x-ray done. X-ray will be normal, but still the patient will have pain, patient will have difficulty in lifting the hand, lifting the arm. So then they go to an orthopedic surgeon, then we examine them, then we check the power of the muscles. Then if we get doubt, then we ask for an MRI scan. Okay, in MRI we'll come to know whether it's a cuff tear or not. Jagan Reddy garu is asking when to use cast and slab. It's a great question, Andy. Sir, for example, uh, there is a distal radius fracture. First of all, we cannot tell this answer in a single line. So if there is a distal radius fracture, okay, and the swelling is huge, okay, if there is severe swelling, then we do the closure reduction and put the slab initially. After 10 days or 1 week, we do the closure reduction and convert the slab into the cast again. Okay, same thing we will apply to the, for example, there is a metatarsal fracture in the foot. Metatarsal fracture, usually we put the slab, not the cast. For the lower limbs, we apply the cast if there is some fracture, like there is some tibia fracture, then we apply the cast, undisplaced tibia. Okay, there is some malleoli fracture, okay, which we are planning to treat it conservatively. It's a chip fracture, it doesn't require any surgery, then we apply the cast, provided if there is not much of swelling. Okay, if there is swelling, then we put the slab, obviously. Even in the fractures of the metacarpals also, initially we put the slab. Usually metacarpal fractures we put the slab, not the cast. So we see if there is swelling or not. Jagan Reddy garu, I hope your doubt is I cleared your doubt. If you have any doubts, please comment in the comment section below again. So the next common question what people ask is, sir, if the x-ray is normal, why we should get a MRI done? Friends, MRI is basically to know if there is any tear in the muscles, if there is any problem in the ligaments. So coming to the shoulder, MRI helps us to diagnose if there is a cuff tear or not, or if there is any Bankard's lesion, Hill-Sachs lesion. These things can be seen only in MRI. The role of CT scan is when there is a recurrent shoulder dislocation, then we advise for a CT scan as well, because to know the percentage of the glenoid bone loss. Okay, when we are suspecting a cuff tear, we don't ask for a CT scan, we ask for an MRI scan. Coming to the treatment options for the cuff tears, initially we try to treat it conservatively if it is a partial tear, but if it's a complete tear and the patient is having difficulty in doing daily routine activities, the patient is having pain, difficulty in moving the shoulder, then we advise arthroscopic cuff repair. Mini open also will give the similar results. Mini open is also it's a great surgical option. Partial tears, yeah, we can wait, we can give a dose of steroid injection. Majority of the times they will have very good pain relief. Whoever is watching the live, kindly comment in the comment section you are from which place. I know this is Sunday. I am in the clinic. I just thought I'll make a small live. Friends, do you have any other doubts about shoulder topics? Another common complaint what we see, or a common entity what we see in the shoulder is the frozen shoulder, uh, also called as adhesive capsulitis, periarthritis shoulder, where the patient has severe shoulder pain and restriction of the range of movements, mostly seen in diabetic patients and patients suffering with hypothyroidism. It's also seen in Parkinsonism patients and CVA, cerebrovascular accident patients. So luckily, frozen shoulder is a self-limiting condition in majority of the patients. So we ask them to go for a good physio. So majority of the times, 90% of the times, they will have very good relief. Very few patients will require a steroid injection. Manipulation under anesthesia is a great option for patients who are not responding for physiotherapy. However, there is a chance of fracture. There is a risk of fracture, osteoporotic fracture, especially in osteoporotic patients. So, arthroscopic capsular release is another great option where we release the capsule arthroscopically. Is it necessary to do surgery in shoulder dislocation? Sir, it's not necessary to do surgery in shoulder dislocation. Having said that, we need to examine the patient. Number one, what is the age of the patient? What is the physical activity of the patient? Whether he is a professional player or he is a very recreational player. Uh, how many times the shoulder got dislocated? So whether it's a first time dislocation or a 10th time or a 20th time. So we need to consider all these factors and plan the surgery accordingly. So there are two friends of mine, both are orthopedic surgeons. One is orthopedic surgeon and another is a urologist. Lab surgeon. They're still happy. They did not undergo any surgery for the shoulder dislocation. So, as I said earlier, we need to see all these factors. Tanir Sabarish Garu, hi and hi. Hi friends, so if you have any other doubts, you can ask in the comment section below. Thanks for watching. Bye.